Good evening to all participants and our guest speaker today. It's a warm welcome from our side, and we. This is Tehmina Sheikh, and I am from the BHMS Doctor. I welcome you all to All India Homeopathic Students and Youth Association. Today we have our guest speaker, that is Dr. J. K. Solanki, MD Homeopath. He will be speaking on the topic regarding. So sorry. I'm so sorry, there is some glitch in this. Oh, I'm so sorry. Just give me a few seconds. I'm unable to see my screen here.
Hello.
Yes, ma'am. I'm so sorry. I was unable to see my screen. Okay. So I welcome you, sir, to our webinar for the AIHSAYA, and the sir will be speaking regarding the management of migraine case-based learning. I hope all the participants have been joined here. Let's not waste the time and move ahead, sir. We would love to hear from you.
Hello.
Yes, sir, you're audible.
Thank you for the warm welcome, and I'm very much obliged to do my second webinar on the same platform. This we can say very pleasant experience doing this webinar for the homeopathic fraternity. I like to thank the association, All India Homeopathic Students and the Youth Association, for arranging such webinars for betterment of education in field of homeopathy. It's nice to know that so many students are engaging in such manner in a, we can say, prime time of their life. So it is very wonderful. Can we start the session or?
Yes, sir, we can start the session now.
Okay. So I will start with this, we can say, presentation. You can see the screen. Okay. Everybody can see it?
Yes, sir, your screen is visible.
Okay. You can hear me as well, right?
Yes, sir.
Thank you, Char.
You're welcome.
So today's topic is management of migraine. Specifically, if we say that is the basis of case-based learning. So why the need of topic is required? If we say the migraine is more or less a day-to-day problem in we can say recent age. So many people are suffering from the same disorder, but yet they might not have addressed the problem in their routine busy life. So that's why we need to do some we can say a therapeutic measure to relieve the suffering. Okay. So myself, Dr. Jay Solanki, and I will take the topic management of migraine case-based learning. Okay, so by definition, what is migraine? So first of all, we have to know that what set of symptoms will be termed as migraine. So it is not like that each and every headache is migraine, and it is not like that every migraine has to be, we can say, classify by excluding each and every, we can say, headache disorders. So by definition, they are the recurrent headaches, which can be focal or we can say occur independently without any focal neurological symptoms. So if we say this, if we know the synonyms of the such terminologies are migraine with aura and without aura. We have, we can say, learned that there is some aura symptoms. Okay, and there is also certain we can say variation of the migraine disease. Basically, they are classified in a sub classification of this migraine. migraine aura, we can say there can be visual. Yes.
Hello, sorry to interrupt, sir. Actually, we are able to see only the email message, sir. Can you share us the PPT, sir? PPT screen, sir.
Okay. Sorry. Okay.
Yes, sir. Now it is visible.
Okay. Sorry for that mistake. Okay. Yes. So if you see the symptoms, there can be aura like visual or sensory aura. Uh, by definition, it will develop more than we can say more than 5 minutes up to 60 minutes. Okay, so aura should be there for at least 1 hour, and after that, the actual symptoms of the migraine will proceed further. Okay, then there is if this aura includes this motor weakness, deferred as hemiplegic. It is very rare. In my study, I have not seen this hemiplegic kind of migraine. Yes, in migraine without aura, there is typical unilateral pattern, pulsatile sensation, and associated with nausea and vomiting, phonophobia or photophobia. Okay, one of them can be, we can say, associated with the typical migraine with aura. Okay. Yes, then there is migraine that occurs more than 15 days every month. Okay, if the headache is occurring more than 15 days, we can term it as migraine for more than 3 months, 3 consecutive months of period. Then it should be, we can say, termed as chronic migraine. So this is the basic, we can say, criteria for diagnosing this chronic migraine. If it is more than 15 days in a month, or for more than 3 months. Okay, if it is continuing for 3 months. So that is by definition, and we have already discussed three variant definition. Yes, for the clinical features, I have we can say classify migraine in a sign and symptoms according to its phase. Okay, so prodrome. So before the actual suffering of headache, there will be fatigue, over irritability, and food cravings. Then if we see the aura, there is visual disturbances like flashing of lights, or we can say blind spot. Patient may certain times say that I cannot see from this farther side, or we can see patient said that I can only see on the central part, or I can see on the left or right side of the we can say visual field. There might be numbness of a particular part. It can be any extremity. It can be whole body, or we can say it can be any specific spot. Okay, there is weakness. Okay, weakness is we can say on the one side of the body or in general form. Okay, so many a times we have seen that the unilateral pain is the we can say key mark for the diagnosis of migraine, but many such general symptom can be seen before the migraine, or we can say during the migraine. Okay, then there is slurred speech and sensitivity to light and sound. Okay, which in turn we can claim that it resulted as phonophobia or phonophobia. Okay, so that is the thing. And if we see the actual symptom of headache, there is throbbing headache. So by definition, we have seen that pulsatile headache, which is we can say in sensation term based, we can say throbbing headache. So we have studied the throbbing pulsatile headache, just like many other remedies like belladonna, glutamine, natrium. So many remedies considered we can say have such phenomena. Okay, if you see the detailing, in 60% of cases, headache is on the one side of particular part. Okay, see, it is not like that. If the headache is on the unilateral side, on the single side, it should be like migraine, or it is not like that. If the headache is on the both the side of the head, then it cannot be migraine. Okay, in children or in certain cases, there is bilateral headache in a migraine. Okay, and it is also considered as migraine. So if we see, there are certain exceptions, and we have to look for that, and it is already mentioned in ICHD3 manual. Okay, yes, and it lasts almost 4 to 72 hours. Okay, so by definition, एक घंटे का तो सिर्फ गोरा रहेगा, उसके बाद एक्चुअल पेन स्टार्ट होता है, एंड देन इट विल प्रोसीड अप टू दी 4 आवर्स अप टू दी 72 आवर्स, मीनिंग अगर हो सकता है कई कई पेशेंट में लगातार 3 दिनों तक सेम हेडेक जो है वो परसिस्ट करता है. Then there is associated symptoms like nausea and vomiting. So other systems are also involved in a we can say typical migraine. Nausea and vomiting, in diarrhea or lightheadedness, okay, then dizziness or ringing in the ear, so tinnitus or all the things. So sensory aura like symptoms can be associated in the during the phase of the migraine. Okay, then postprom. Okay, postprom means suppose headache episode है, migraine है, वो हो चुका है, अभी उसके बाद so there can be fatigue, there can be euphoria. Why euphoria? Because if we see by definition, patient has already suffered with we can say almost 4 to 72 hours. Okay, so 4 to 72 hours के suffering के बाद अगर वो pain खत्म हो जाता है, तो it is very common that patient can feel euphoria कि भाई हश अभी खत्म हुआ. So he might feel very well or we can say very obliged after completing this particular scenario. Okay, then there is surging energy and increased appetite. Okay, and sound sleep can be there. Okay, so such kind of symptoms are usually seen in the migraine cases. Okay, management. अभी management में क्या करेंगे? Treatment में देखें, so most of the time we are just treating the acute episodes. We are not dealing with the complete picture of a disease. So more or less we have just acute episode of a certain migraine disorder. Okay, the problem is there is recurrences. Okay, acute episode में एलोपैथ के पास जाएगा और कोई भी मतलब विदाउट डायग्नोसिस आप सीधा सीधा दे सकते हैं कि भाई चलो हेडेक हो रहा है, ऐसा हो रहा है, बेलाडोना खा लिया, नेट्रोमिल खा लिया, इस पर दी मोडालिटी. So most of the time neophytes and students used to do such mistakes in the treatment or management of case. Okay, so if the single particular symptoms are we can say fetched by a newbie student, then there might be a chance that they will prescribe in a FSR. Okay, but this particular big problem recurrences. Okay, आज के दिन के लिए आपने माइग्रेन ठीक कर दिया, कल का क्या करेंगे? Or there might be certain pattern, but it is not like that. If we see patient doesn't know that when the next we can say episode will occur, so that is the problem. Okay, so recurrence has to be we can say managed. Okay, and right now if we see what is the role of homeopathy in management of migraine, so that's how I can say we have to learn a method that how we will manage such cases, okay, with the help of our homeopathic literature or with the help of our material medical. Okay, so I'm jumping over to the actual case part. Okay. Okay, is it visible to all?
Yes, sir.
Okay, so this is the case of migraine with aura, a very beautiful case. Whenever I was residing in Anand Vidyanagar, one of my hostel mate was suffering from such disease, and this is the case of the same person. Okay, he used to we can say his room was just in a next corner to our room, so we were like having a we can say a hi hello on a routine term. So he's going to his college, and I was we can say going to the OPDs and college. So that is the case, and his friend is our common friend. He we should suggest that our friend is suffering from such problem. He is having so many trouble. He can't sleep. He can't eat. Please do something. So as they all know that I am doing PG in homeopathy, so they know that we should do something because he is having such episodes on and off. So they we can say call me that please come in the room. see that he is suffering with so intense headache that he can't eat anything. He is like lying on the bed just like a log. Okay. So I have seen the case, and one thing is we can say this whole case was given in English, so there is no, we can say, translation of any particular term. So many a times it happened that certain time patient in Gujarat specifically, patient used to tell their suffering in a local language or vernacular language, but the problem is that certain translation might not happen as easy in English. Okay, so at that time we are certain times can be biased, but here in this case it is totally given in English, so there is no chances of bias. Okay, so starting with the case. So case number is given and all. Date we should refer right now because we will check in the follow. So it is taken on the 3rd of February 2021. Okay. Mr. MRM, age of 20. So he is 20 years old and he is pursuing a bachelor in political sciences. Okay. Yes. So ODP, start case over. Patient was asymptomatic before his third standard school. Then after he had injury on the head while playing cricket. Okay. तीसरी कक्षा में था तब खाली उसको हेड इंजरी हुआ था. Okay. वो भी एक अच्छा किस्सा है. Patient told that he is having, they were playing with the we can say friends, and this particular patient hit the ball just like we can say a beautiful shot, and the ball lost in the, we can say, field, and all these kids are, we can say, trying to find out the cricket ball. Okay. And during that time one of the kid found the ball, but other kid who has this stick kind of thing, he just swing it, and a patient who was we can say stooping, and he was trying to rise from this posture, and he had a hit on the occiput. Patient narrates that he has certain bleeding, and he just rub it over the part that he is feeling very much pain and all, and he's like, okay, सब कुछ सुन हो रहा है. Okay, there is a kind of blackout, and I'm falling on the ground. And last thing he remembered was that okay, I just rub over the part and see the red blood all over my palm. Okay, and that is the thing. Then he just snapped in the, we can say, almost unconscious phase. Next phase, his elders, they are carrying him, taking him to the we can say hospital. Okay, as the patient was unconscious. So after this incident, he had these episodes of migraine. So after recovering from this incident, there was no such serious injury in the head. So after this episode, he has migraine. Okay, every 3 to 4 days per week. हफ्ते में 3 से 4 बार headache होता है. Okay, तब से चालू है. So from the 3rd standard to the, we can say, college life. Okay, yes. So almost 12 to 14 years of history is presented in this case. If we see the location, it is typically in the forehead part. Okay, and it is extending up to the occiput part. So I have, we can say, picturized this thing in the case record format. So forehead part and this we can say occiput part here, we can say having the headache. Okay. If you see the sensation, there is we can say elements from injury. If we consider that after this strike he is having headache, then pressing type of pain. Okay, he says that pressing type of pain with heaviness. Okay, सर एकदम भारी भारी हो जा रहा है ऐसा. If you see the modality, a light aggravation +2. Okay, lights aggravating. So whenever he's having headache, he used to do the curtains all over the windows, close the door, and even we can say he used to instruct his roommates that don't turn on the light. Okay, I'm having severe headache. Please don't call me. Don't even ask me to eat anything. Okay, you just hang on yourself. Please let me rest. So that is the thing. Then mental strain. He can't, we can say, comprehend. He can't work on his routine life. Shaking head aggravation +2. Okay? If he moves his head or shake his head, then there is aggravation. Aggravation, noise, amelioration from cold climate. So one of the pattern is seen that when there is cold season, he used to feel little bit relieved. Lying down without pillow, +2. Okay. So lying down can be ameliorating thing, but the marked modality was this without pillow. We can say consider this part. Then there is dark, amelioration from dark, amelioration from sleep. सो जाने से अच्छा लगता है, अच्छा स्लीप हो जाए तो भी अच्छा है. वॉशिंग फेस विथ कोल्ड वाटर. अगर suppose headache severe है, then I has to this we can say wipe the entire face with cold water. If it is chilly cold water, it is good. Then concomitant symptom, coldness on the extremities +2. Patient says that मेरे हाथ सुम हो जाते हैं, एकदम ठंडे हो जाते हैं, पता नहीं चलता. Wants to shake them. He used to shake them. He has to move his extremities. Okay? Due to coldness, or we can say due to inefficiency to move. Then associated symptoms, sees only half of the visual field. Patient says that पूरा नहीं दिखता है. जब भी ऐसा हेडेक का कुछ भी एपिसोड होता है, little bit, or we can say half vision ही खाली दिखता है. Okay? Peripheral visions is not very visible. Yes. Other symptoms, pain in the nape of the neck. So patient used to say, यहाँ पे खास दर्द होता है, pain in the this nape of the neck. Episodes, we have considered that it is almost 2 to 3 episodes per day during the case was taken. Migraine day is almost 10 to 12 per month. एक महीने में 10 से 12 बार same kind of episodes होते हैं. Time more or less morning. So patient has a we can say aura that आज I will today I will have I will be suffering from this phenomena. So from the morning itself, he used to tell his friends that please leave me today. Okay, I will just rest in my bed. Okay, and nobody was allowed to, we can say, even knock his room. So everybody was like even his roommate, he used to lock the door from the outside. So everybody will think that this room is locked and nobody is inside. Okay. Yes. Intensity, that is 10 on 10. Okay. So superior, we can say, severity is seen in this case. Okay. What is before the headache? Okay. Crescent moon like sparkling thing on the visual field. Patient used to say that just like a crescent moon, okay, जो बीच का जो हम चांद देखते हैं, okay, उस तरह से कोई चमकती हुई चीज visual field के सामने आ जाती है. So I cannot see properly things. Okay, this kind of sparkly things are on my visual field. Then during headache, this sees only half of the visual field. सिर्फ आधा ही दिखता है. Okay. Yes. Past history, typhoid before 2 years. So he has suffered with the typhoid fever and treated with the we can say allopathic treatment. Yes. Family history, there is epilepsy. Father was suffering with epilepsy. Mother was having hypertension. Paternal grandfather had hypertension and died due to cardiac arrest. Paternal grandmother, hypertension and diabetes. Maternal grandfather, healthy when alive and had natural death. So there is no, we can say, history. We can say we had during the narration of a case. He just told that my grandfather died, and I don't know the reason, but it was natural. So there is no such we can say pathological cause. Maternal grandmother had uterine cancer. Okay. So this is the family history. Obstetric history, it is not taken readily as the patient was suffering. Physical generals, addiction, there is smoking and chewing tobacco. Okay. After coming in Gujarat, patient just learned 2 things about Gujarat, that Kemcho and this Mawa. So he's started chewing tobacco. And he used to do it with the charm that, okay, certain times I do need that certain mawa can be a good thing. Okay, so he used to occasionally chew these things. Yes, appetite, doesn't like to eat food. Okay, he just don't want to eat anything. He just don't want to eat. He just want to drink. Okay, मुझे खाना नहीं चाहिए, आप कुछ पीने को दे दो, चलो वो चलेगा. Okay, thirsty. Okay, so basic quantity was patient cannot comprehend at the same time, because the case was taken just after the day of particular episode. So patient was very much exhausted, but he used to do something that please do something. So at that time, patient says that I'm very thirsty, but I cannot comprehend. Okay. Yes, food and drinks अगर देखें तो ailments में कोई specific नहीं मिला. So certain things are can be, we can say, triggered for the migraine. Okay, MSG or certain things we can say can be a cause of migraine episode. Certain times coffees and certain beans can causes migraine. Okay, if you see the desire, patient desires liquid diet. Okay, he wants juicy things. Then there is spicy, salty, and sour things. He is very much foodie. When he has no, we can say, migraine episodes. Then citric drinks and juices. One of the time, his friend told me that many a time it happened that whenever he is having migraine, he used to tell me that please bring lemonade. Okay, I want to eat this. I want to drink this lemon juice. I won't eat anything. Just bring me a lemon juice or certain, we can say, soda or anything, just like limca or anything. Okay, so citric drinks. Then aversion to food, +3. You don't want to eat anything. Then bitter things, okay, and eggplant. So this is the, we can say, aversion. Then intolerance, I cannot, we can say, reach to any intolerant aspect of the food. Stool, that is 1/0 every morning, daily, without any such abnormality. Urine, that is 2 to 3 times a day, and 0 by night. Perspiration, scanty on forehead. Okay, that is the, we can say, it's a unique part of this patient, that only the forehead part was having perspiration. Sleep, that is increased. Okay, so that is the thing we can say in the migraine. So patient exhausted by such, we can say, episode. Dreams, nothing specific. Seminal discharge, NAD, there is no abnormality. Which is not applicable. Thermostat or patient. Okay, patient says that I need open air, cold air. I do like winter season. Okay, and certain times I do like this we can say monsoon also, because cool breezes are there. So yes, and doesn't like doesn't want to be covered. Okay, so that is his we can say thermal modalities. Okay, and general modality, that is emigration from cold climate. Physical examination देखे तो conscious है, well oriented है, thin है, built average, and with having proper nutrition. Yes, height and weight is like 5 feet and 54 kg. Anemia, jaundice, cyanosis, nothing was there. Okay, in the skin there is no abnormality, not even in the history. Nails were almost pinkish. Okay, no abnormality in we can say gait and anything. No lymphadenopathy. Blood pressure was like 112/78. Pulse was 72. So this thing was measured after the, we can say, episodes. Temperature was 97.8 Fahrenheit. Respiratory rate was 16 per minute. Okay. Systemic examination में अगर देखें तो the, we can say, CVS S1 S2 was present without any we can say abnormal murmur, and the respiratory bilateral air entry was present without any, we can say, areas or trickling or anything. So as such, on the systemic part there is no abnormality was detected. Okay, now we jump over the life space part. Okay, so there is certain, we can say, a special moment in his history. If we consider only child to the separated parents. Okay, So he was the single child, and their parents are already divorced, and he used to live with his mother. And he is very fond of his mother. So he's a very good kid and with a good heart. But his history was little bit problematic. Okay, so we will see episode by episode. Okay, so there is a statement. He told it that his father was like just a visitor. He just mentioned this term visitor because he used to visit him on and off, almost we can say once a year, okay, or in a special occasion. Okay, he is living in the, we can say, almost village near about to the Kotai. Okay, his mother is advocate, so he's practicing law and doing good. He has raised a very good kid, but problem is that he is very detached to his father. Okay, and that is we can say spontaneously given by the patients. Okay. His mother has had conflicts with the with his grandmother, and when she came to know that she is pregnant, she left her in-laws house and went to her we can say her home, okay, her maternal home. So that is the history. Okay, सास बहू की प्रॉब्लम से प्रॉब्लम थी अनबन हुई है, but problem क्या है, when she has conceived this patient, she used to, we can say, she ran from this we can say in-laws house. Okay, उसके पीछे की story simple है that she doesn't believe in them. Okay, she is like that. I cannot survive in so many we can say harsh people. Okay, so she wants to give a good we can say nurturing environment to the child. Then there is no emotional bonding to his father. Okay. After moving, we can say moving to his parental home, patient didn't feel that much connected with his own father. Okay, अगर उसके father suppose आए भी हुए तो he's just like okay, he is like a visitor, somebody else. Okay, it doesn't make a big difference if his father is there or. Okay, the only memory he has with his father is just that he used to play cricket with him. Okay, that is the, we can say, only contribution to his life. This was his own. Okay, his father hadn't showed any care for him even when he was sick or whatever. Okay, even during this episode when he was hit with this we can say stick or bat, his father was not the one who is carrying this child to hospital and do all the things. Okay, but his mother was running after the, we can say, stopping the rickshaw, and she was pulling him and she was carrying him. Okay, so there is no father figure in the entire episode. Okay, quarrels of the patient. His patient used to quarrel now and then. So as we know that they are divorced persons, but before that they used to quarrel a lot. Okay, so in his early childhood he used to remember that once her own mother was dragging him to throw in a well. Okay, ये एपिसोड बहुत ही मतलब दिला देने वाला है. Patient even feel this particular sensation. Okay, he was digging nails in grounds to prevent it. Okay, yes, he didn't even know that what is happening. Okay, so he was a small kid, and his parents are, we can say, quarreling with so many, we can say, harsh words and all. But he is not, we can say, understanding or getting the things that what is happening and everything. So in one incident, his mother was so furious that she just catch him and pulled him to throw in a we can say near about well. Okay, पास के कुएं में उसको फेंक देना चाहिए. Okay, पेशेंट क्या कर रहा है, अभी छोटा बच्चा है जिसको कुछ समझ नहीं आ रहा है. He just we can say stopping her mother by grabbing, or we can say boring his nails in the ground. Okay, and patient told me that he has this sensation. Okay, मेरे नाखून ऐसे जमीन में गड़े हुए और मेरी माँ जो है वो मुझे खींच के ले जा रही, टांग खींच के मेरी ले जा रही. और these are they, we can say they are having very friction, dirt and all the things are, we can say, stuck in his nail, and he just looking like this, that I can feel this sensation that how the scenario was happening. Okay, I still can feel this very moment. Okay. Yes, fear. So I asked him, what are the fears? So he said, I fear the losing the loved ones. Okay. Yes, mother and girlfriend. So there are two, we can say, basic persons that the patient is very fearing that if I lose these persons, then there is no life for me. Okay, my whole, we can say, my whole existence is dependent on these two persons. Okay, one, the foremost is his mother, and the second person is his girlfriend. Okay, after coming Gujarat, he has this interaction with his one of the classmate, and she, we can say, took care of him. She used to buy certain food for him because we are living in hostels, and his fresh homely cooked meal was delicacy, and he used to, we can say, like this Gujarati food. So by such scenario, he used to grow this feeling for the particular girl, and he told me that if I lose this girl, I don't know what will I do. Okay. Then I will ask. I had asked that what will happen if you lose them. Okay. Patient said this is the actual word of him. I can't even imagine my world without them. They are my stabilizers. Okay. Stabilizer word was there that if there is any situation, they are the persons who will control me, or we can say bring me to the harmony. They are the only persons in the world for whom I care enough. Okay, बाकी किसी को कुछ भी हो जाए उसको कुछ फर्क नहीं पड़ता. Okay, so these two people, they are the, we can say, solo character in this entire journey. Irritation. Patient has tendency to feel irritated during migraine episodes. This can be a common thing, but now it is uncommon. Even when his loved ones are coming to meet him or massage his head, he told them just go away. Okay, so he used to. He told me that I feel very irritated. Okay, but problem is that I don't want to meet any people. Okay, even the loved ones. So if the girlfriend is coming, or she is calling that please just come to meet me downstairs. Okay, I am just standing over here. He just tell her that please go away. I don't want to meet you. Okay, the girl is, we can say, trying to do certain things for him. Okay, she used to massage his head. Okay, he told me that one particular incident, he was, we can say, staying. He was sitting in a bench with her, and they are like studying or gossiping things. But at the same time, his headache, we can say, started, and she used to calm him with the, we can say, massaging. Okay, he said, and he was like that. Okay, but I don't want to be, we can say, this massaged. Just please go away. And he used to, like, we can say, run from the situation. Okay, just I will go to my room and just sleep. That's it. Nobody can, we can say, relieve this trouble from my side. Patient doesn't like to answer anyone during headaches. Okay, so that is the peculiarity. He doesn't want to be answered. Okay, he doesn't want to be questioned during this phase of headache. Okay, then wants to be alone. Okay, during this particular time. Anger issues. Okay, so anger सबको होता है, but specific क्या है? So in the patient's word, I am very short-tempered. So this came spontaneously from my side when I asked that tell me certain things about your we can say behavior. He told me that he told me just I'm very short-tempered. Okay, his roommate, our common friend, mentioned that once he was so much angry that he just threw things away. Okay, patient ने directly बोला, sorry, one of our common friend, that भाई उसने तकिया पकड़ के ऐसे उछाला कि कुछ होगा. And that was the we can say intense reaction from the bystanders. Okay, so his roommate, कि भाई जब उसको हेडेक होता है वो उसको नॉक नहीं करना है, उसको कुछ पूछना नहीं है, भाई तू खा ले, ऐसा कुछ भी करेंगे वगैरह कुछ नहीं करना है, जो भी हो रहा है होने. He is just sleeping. Okay, we should not disturb him. That's the only thing they can do for him. Okay, कभी कभार एज अ फ्रेंडशिप लोग करते हैं कि भाई तूने पानी भी नहीं पिया है, सुबह से शाम हो गई, पानी तो पी ले एटलीस्ट. बट ये भी कुछ नहीं है. वो सीधा मतलब जो भी हाथ में आएगा जा, जस्ट गो अवे. दैट्स इट. Okay, and this incident we can say shook our friend that this is very we can say problematic. Okay, इसका कुछ करना पड़ेगा. Patient
Your
was amazed.
audio,
Yes.
I'm so sorry. So your audio was disappeared in between. We'll last just for a few seconds. If you can repeat, please.
Okay. Okay, I'm audible.
Yes, sir. You're audible now.
Okay. Patient was amazed that really did such thing and doesn't even remember such incident. Okay. अभी ये सब फेंका फेंकी वाला काम हो गया है, पेशेंट को याद भी नहीं है. So he's so much angry at that time that he didn't even we can say recalling such things that I didn't do it. I don't know. We are talking about this the rubbish thing that I just throw these things and I don't. Okay. So patient is we can say angry person, but we can say only in the phases of this headache. Okay, so that's why this particular migraine should be treated. Okay, migraine is just changing his own personality. Okay, so that's about the case. These are the only details was taken from my side, and that is we can say more or less sufficient. Okay. Should we directly go for the we can say processing part?
Yes, sir.
Okay. Okay, so case processing. For the differential diagnosis, if we see there can be migraine with typical aura, then typical aura with headache. It is a we can say subclassification of migraine. Then benign paroxysmal torticollis. Okay. In this, it is given in episodic migraine. Okay, episodic headache उसमें दिया हुआ है. उसका भी ये सब टाइप है. Okay, 6.1.1 अगर हम कंसीडर करें तो उसमें पेरोक्सिज्मल कभी कभार ऐसा होता है कि टॉर्टिकोलिस जो राइनक बोलते हैं, okay, वो प्रेजेंट होता है. Then there is probable migraine with aura. Okay, one beautiful thing that probable migraine में क्या होता है, generally migraine with aura के सारे symptoms मिलते हैं, but certain symptom which is not present or which is off without aura, there can be a we can say a possibility. So in that time we should consider that probable migraine with aura. Okay, so aura के सारे symptoms रहेंगे, sensory or we can say visual aura or everything, but the symptoms of migraine without aura, just like the time duration, at least 4 to 72 hours, or pulsatile headache. Okay. Provisional diagnosis, migraine with typical aura. Diagnostic criteria, this is taken from ICHD3. Okay, so it is fulfilling the we can say attacks fulfilling the criteria of migraine with aura, and criteria B, that is fully reversible visual, sensory, and or speech or language symptoms. Okay, and there is no motor or brainstem or retinal symptoms. Okay. Diagnosis of the disease, final diagnosis, migraine with typical aura. Diagnosis of phase of disease as per organo, that is fully developed chronic disease. Okay. Enumeration of symptoms. So in the whole case, there is elements from injury, pain in forehead extending to forehead, piercing type of pain, heaviness of head. This is only half of the visual field during headache. Crescent moon like sparkling things on the visual field. Aggravation light +2, mental strain, shaking head +2, noise. Amelioration cold climate, lying down without pillow +2, dark sleep, washing face with cold water, pain in nape of neck. Then there is coldness on extremities and wants to shake them. Patient is thirsty and he desires liquid diet, spicy, salty, sour things, and citric drinks and juices. Aversion to food +3, bitter things and eggplant. Scanty perspiration on forehead, increased sleep, hot patient, amelioration cold climate, patient doesn't like to answer anyone +3. Short tempered, irritated when talking to anyone. Okay, so these are the things we can say enumerated in entire case. Okay, complaints in chronological sequence. So patient is suffering with migraine, and then an acute episode, there is we can say history of life. Okay, so there is no evolution of disease if we consider in a particular this case. Analysis and evaluation was done by the help of Kent's method, okay, which is also given in this VK Sarkar. Okay, so mental generals, patient doesn't like to answer anyone, +3. First grade will, short tempered, first grade emotion, irritated when talking to anyone, first grade emotion. Okay. If we see the physical generals, patient doesn't want to eat during headache. Instead, he wants juicy things. Okay, that is first grade physical generals. Then coldness in the extremities, that is second grade physical generals. And what patient, the modality of is second grade. Then physical particulars sees only half of the visual field. First grade symptom. Headache. Headache itself is a, we can say, taken as a common symptom, but what it makes the, we can say, uncommon, that modality part, that amelioration from cold climate or lying down without pillow, dark sleep, washing face with cold water as it is, aggravation light, +2, mental strain, shaking head, noise, and pressing type of pains in the temples, third grade physical particular, and pain in the nape of neck, third grade physical particular. So this is the analysis and evaluation as per Kent's method. Okay. Totality of the symptom. Patient doesn't like to answer anyone. Okay, that is the first symptom. Patient doesn't want to eat during headache. Instead, he wants juicy things. Okay. Coldness in extremities. Patient, headache, amelioration from lying down without pillow, sleep, washing face with cold water, aggravation from shaking head, mental strain, light and noise. Pressing type of pain in temples. So sensation and location is also taken. Okay. Selection of the technique. So repertorization was done by the synthesis repertory, the software, radar software. Okay. Yes. With the repertorial approach instructed by Chetikin. So I have followed the same format as mentioned by the Chetikin. Okay. So this is the repertorial totality. Okay. Mind answering aversion to general food, food and drinks, food aversion to general warm aggravation, general food and drinks, juicy thing desire, head pain, lying amelioration, head pain, sleep after amelioration, extremities coldness, head pain, shaking head pain, mental exertion aggravation, light in general from light in, noise from, and pressing in temples. So these are the rubrics I have taken, and this is the repertorial result. Okay. So we can see these things. Okay. Okay. So yes, repertorial result was phosphorus, belladonna, china, clonine, netramute, naxomica, phosphoric acid, and so on. But there is a we can say one thing. I did not do repertorization at the time of we can say case taking or at the time of prescribing. I did it after we can say prescribe my first remedy. Okay, so by instance I just go with the intuition and prescribe the remedy, and I just like let us see if this acute episode is we can say healed very easily, and then we can go with the complete case. So I was like just give me a acute remedy and just leave the case. When he is fully fine, or we can say the episode is completed, then I will take the complete case and complete history and all. Okay, so that's why I have prescribed the remedy, and this repertorization was done after prescribing. Okay, and that is the we can say learning part in this particular case. I learned these things from the case. We will see. So remedy correspondence and selected with the result. Remedies confirmed from the repertorization result by indication given in genoseeking, okay, which are as follows. So these particular steps were done after prescribed. Okay. So in the genoseeking, okay, in this book, what was written? Hemicrania sees half light, half dark. Okay. As the patient has said that I see this crescent like moon and I only can see the half of the visual field. Violent headache and cold feet. See cold extremity with violence in headache. Headache begins with warm weather and lasts all summer, increases and decreases every day with the sun, great sensitiveness to rays of the sun. Okay, so we can say there is a warm weather aggravation and all. Okay, it is written just like this in the. Okay, it is as it is. There is no we can say adulteration in the literature. From shaking or jarring head, reading, writing. Okay. Then amelioration, open air, and after sleep. Okay. All these things were, we can say, considered in totality, and patient told it very clearly in a case. Okay. Planning in the past history. Typhoid was there before 2 years, so miasm was considered. Sora because no such we can say complicated complication occurred after this treatment of the typhoid. Okay. In the family history, father alive and we can say has suffering from epilepsy, miasm Sora. Mother alive having hypertension and miasm is Sora. Paternal grandfather is dead with cardiac arrest. Okay. Miasm psychosis. Paternal grandmother alive having hypertension and diabetes mellitus. Top test psychotic miasm. Maternal grandfather died with natural death. So this particular instance, miasm was not confirmed. Maternal grandmother dead, had uterine cancer, and the miasm was considered as psychosis. Okay, diagnosis of miasm. Dominant miasm was Sora. System in which disease affect, that is nervous system. Other affected symptom was psyche of the patient. Pace of the disease, that is very slow. Actively inward organ, that is brain, against a particular head. Pathological changes was none. Affected function was pain specifically. Expression of affected part, that is change in mood and disposition. Okay. Fundamental miasm was psychosis. Selection of potency and with the reasons. In this case, patient had acute episode of migraine. Okay. And the case is full of distinctive physical particulars, which can require frequent repetition. So the potency is 30 selected. Okay. So as the we can say starting of the presentation, we said that in acute case we should manage the migraine. Okay. But in this instant, patient suffered with a severe headache. सारा दिन हेडेक चला है, सारा दिन उसका माइग्रेन चला है. शाम को 7 बजे आके ये सारी कहानी हो रही है, केस टेकिंग वगैरह हो रहा है. I remember that almost 57 minutes उसका पूरा recording चला था. I used to record the complete case by recording. Okay. So in this span, I was just like, okay, अगर इतना severe case है, then it might need, we cannot say that okay, a single remedy with a single dose is given and we will leave the case. Okay. So I was just like, okay, we made it that we have to prescribe remedy with the frequent repetition. So I selected this low potency. Okay. And at that time I had intuition with the remedy. Okay, that okay, we will try this remedy and nothing else. Okay. And problem is that we were in the hostel itself. So OPD and all the things where we can say close. So there is we can say lack of medicines which is available for me. So I have prescribed the remedy which was handy to me and just did it and go with the flow. Okay. So next part, conclusion of the conclusion and prescription. So on the same day, Glonine 30, 4 pills was prescribed, BD for 7 days. So I told him that take twice a day. General management. Patient had been informed to prohibit himself from general triggers of migraine. सारे ट्रिगरिंग फैक्टर्स मैंने उसको समझा कि ये चीजें ध्यान रखना है, हंग्री नहीं रहना है, स्लीप को वी कैन से डिले नहीं करना है, पानी ज्यादा पीना है. ऑब्जर्व द एक्शन ऑफ मेडिसिन एंड मस्ट रिपोर्ट एज सून एज पॉसिबल. यस, ये चीज मैं हमेशा कहता हूँ पेशेंट्स को कि आपको रेमेडी का एक्शन ऑब्जर्व करना है. ओके. और जो भी इफेक्ट आए, अच्छा हो बुरा हो जो भी हो, एज इट इज, मतलब सीधा आपको इन्फॉर्म करना है. Patient is advised to take note of further episodes of headache for detailed and accurate comprehension of his complaint. Okay. अगर आगे कभी होता है तो उसका नोटिंग करना चाहिए. Okay. I told him that just write the things. Okay. So when the aura is developing, he just feel the things, but he is not telling to anyone and nobody knows. And after we can say postmortem of the migraine, he we can say forgets the thing, or he might not easily comprehend the feeling. So when we can say aura is happening, the phenomena is happening, just write it, or we can say tell to anyone. So he will tell me after the we can say episode is completed. Okay. Follow up देखें. In the 17th of February, duration and intensity of episodes is decreased. बराबर? Glonine 30. See, अभी मैंने बोला था कि start में देखते हैं. So patient has, we can say, taken Glonine on the day of 3rd February. After 14 days, 2 वीक तक कोई बातचीत नहीं हो. मैंने सोचा था कि हो गया होगा, ठीक हो गया होगा, फिर कोई रिकरेंस नहीं हो, कोई नया एपिसोड नहीं आया. या फिर हो सकता है कि पेशेंट को कुछ अच्छा ही ना हुआ, वो सो गया था, फिर भूल गया कि भाई मैंने कोई दवाई ली है, या फिर ऐसे कि ये दवाई काम नहीं करती तो क्या है अभी, इसलिए दिखाने नहीं आया होगा. सो patient just we can say pass the time of the almost 2 weeks. Okay, then there is we can say slight improvement after this thing. On the 24th of February, no new episode has presented. Patient feel better in general. So हम कैफेटेरिया में मिले थे. So we were taking dinner. I was just coming to the dinner and he was just like he has completed his dinner and he was going to his room. And in a brief moment of time, he said that after that particular dose, I didn't feel, we can say, anything. I don't have any new episode of migraine. So far, everything is good. And he feels better. Okay, okay, भाई सब कुछ बढ़िया चल रहा है, अभी कोई दिक्कत नहीं है. Okay. So for that time, I prescribed him Seclen. I told him that please now stop this remedy. You are not taking it. Stop it. Take these instead. Okay. ये दवाई चालू रखना है, ये 3 बार लेना है. Okay. और पेशेंट को मैंने ये बोला कि ये अभी ये दवाई चालू रखोगे तो इफेक्ट मिलेगा. Okay. So on the 3rd March, patient had 2 new episode of headache. Okay. अभी 2 episodes आ गए. ओरा डिक्रीज फॉर 15 मिनट्स. ओरा जो पहले लंबा चलता था, ऑलमोस्ट 1 घंटे के लिए चलता है, वो भी 15 मिनट पे आ गए. कि ओरा 15 मिनट चला फिर सीधा हेडेक स्टार्ट हो जाएगा. हेडेक विथ नोजिया. ओके, दिस इज ओल्ड सिम्पटम. On this day, particularly 3rd March, I came to know that he had this headache with nausea. Okay, so right now we can call it that this case can be probable migraine with nausea. Okay, then this acidity पहले हुआ करती थी, अभी ड्यूरिंग केस टेकिंग कुछ बोला भी नहीं. मैंने पूछा, कुछ ऐसा पेशेंट ने नहीं बताया. बट एट दिस टाइम एसिडिटी विच इज एमिलेटेड बाय ड्रिंकिंग फ्लूइड्स. बराबर, कभी कभी एसिडिटी होता है, पानी वानी वगैरह सब पी लेता हूँ, जूस पी लेता हूँ, तो तब अच्छा हो जाता है. दैट वाज आल्सो ओल्ड सिम्पटम which is favorable in our case. Okay, so that's why I prescribed Seclen. Okay, पूरा भी कम हो गया है, ओल्ड सिम्टम्स आ रहे हैं, मतलब अच्छा चल रहा है. चलो 2 नए एपिसोड आए, वो कोई बात नहीं है. बट इट इज नॉट लाइक दैट इफ वी आर प्रिस्क्राइबिंग रेमेडी देयर शुड बी नो न्यू एपिसोड. ओके, ऐसा नहीं हो. सो we should not be worried very much about this new episode. Okay, we should just thrive to the, we can say, what new peculiar symptoms are coming. Okay, on the 17th of March, patient feels better in general. He has 1 new episode, no nausea, no acidity, and pain lasts for few minutes. एक ही एपिसोड आया है नया, एक ही बार हेडेक हुआ है, बट अभी कोई ज्यादा बड़ा प्रॉब्लम नहीं है. हेडेक हुआ वो भी कम समय के लिए, ओरा तो पहले ही कम हो चुका है. ओके, सो ओरा भी ठीक हो गया है, मतलब कम हो रहा है. पेन जो पहले परसिस्ट करता था पूरा पूरा दिन, वो अभी थोड़ी दिनों के लिए चल रहा है. पेशेंट ने बोला था कि जनरली या 4 से 5 मिनट के लिए चलता है. मैं बता नहीं सकता, मतलब सपोज हेडेक हो रहा है, मैं बैठ गया हूँ, मैं सो गया हूँ, थोड़ी टाइम हुआ, 5-10 मिनट हुआ, और फिर जस्ट लाइक दैट ओके मैं हो गया रेडी. ओके, सो ही जस्ट नीड अ वी कैन से शॉर्ट टाइम ब्रेक. ओके, on the 1st April, so after 2 weeks, patient has occasional pain in head for 2 to 3 minutes, which resolves on its own. Okay, no aura symptoms have been observed. Okay, अभी तो ओरा भी नहीं आ रहा है, चलो ओरा खत्म. ओके, हेडेक हो रहा है, बट कितने 2 से 3 मिनट के लिए, खाली 2 से 3 मिनट के लिए हेडेक होता है. वो भी कभी कभार होता है तो बैठ जाता हूँ, सो जाता हूँ, फिर वापस ठीक हो गया, तो फिर वापस मैं अपना काम पे चालू हो गया, पढ़ रहा हूँ, मोबाइल पे गेम खेल रहा हूँ, कुछ भी हो, वो उसका रूटीन जो है वो चालू है. दोस्त के साथ जाना है, वो भी ठीक है. सो खाली 2-3 मिनट के लिए परेशान होता है, वो भी कभी कभार. ओके, पूरा तो बिल्कुल नहीं है, पता भी नहीं चलता कि आज हेडेक होने वाला है कि नहीं होने वाला. होता है 2-3 मिनट के लिए होता है, फिर है. ओके, सल्फर 1 mg was prescribed. Okay, in the book EP and Shoots, I read that sulfur used to, we can say, shortens the recovery of a case. Okay, so sulfur 1 mg, 1 dose of 4 pills dissolved in half cup filled with water. Okay, so एक ही डोज दिया है, वो भी पानी के. Okay, on the 4th May. Okay, पूरा एक महीना निकल गया. मई महीने में फुल समर चालू होता है. So that was the, we can say, one of the we can say trigger point for the patient. Patient is almost asymptomatic. मई की गर्मी में भी पेशेंट को प्रॉब्लम नहीं हुआ है. Occasional negligible pain in head without much difficulties. कभी कभार negligible pain होता है. Patient we can say कई बार perceive भी नहीं करता. Imperceptible pain we can say. तो अभी almost patient we can say बहुत अच्छा चल रहा है. So no medicine was given and patient is advised to contact immediately for any new episode. Okay, अभी yes, इस पूरे we can say follow up पे अपन देखें. मैंने ग्लोनाइन बाय इंट्यूशन दिया था. ओके, देन केस को इजीली खत्म करने के लिए, जल्दी खत्म करने के लिए सल्फर दिया था जो इंश्योरेंस में लिखा था. ओके, उसके अलावा कोई रेमेडी दिया ही नहीं है. जो पहले ग्लोनाइन दिया वही चल रहा था, उसके इफेक्ट से सारा खेल खत्म हो गया. सो मेरे लिए लर्निंग पॉइंट क्या था? इफ many medical students used to say that certain remedies acute remedy, certain remedies chronic remedy. Okay, we seen that so many patients used to say that students used to say acute grief ignatia, chronic grief net remedy. Okay, so similar manner में suppose acute headache है, belladonna दे दो, ग्लोनाइन दे दो. Even I used to do the same practice, but अभी इस केस से मुझे क्या सीखने? अगर हम ग्लोनाइन को एक्यूट समझते हैं तो ये 12-14 साल का जो पुराना केस था वो इतनी इजीली फ्यू डोज से कैसे क्लियर हो गया. ओके, सो दैट वाज द लर्निंग पॉइंट इन दिस एंटायर केस. ओके, सो ऑब्वियसली द केस इज फुल ऑफ वी कैन से पर्टिकुलर्स एंड जनरल्स, बट दिस थिंग ग्लोनाइन 30 ओके एज एन एक्यूट रेमेडी treated the case. Okay, yes, the thing why I thought about Glonain, okay, that is we can say answered over here. Yes, this particular modality, lying down without pillow, okay, which is we can say unique feature of a Glonain case. Okay, if we see if we read the Glonain head particularly, तो सारी की सारी तकलीफ मतलब उसी को दी. बट उससे भी ज्यादा बेटर हमको जो आता है वो है बेलाडोना. सो एज अ स्टूडेंट हम खाली इतना ही सोचते हैं हेडेक है बेलाडोना दे. सो इस केस में ये भी लर्निंग पड़ रहा है. ईच एंड एवरी हेडेक इज नॉट बेलाडोना. ओके, कभी भी सर दर्द हो रहा है बेलाडोना दे दो, हो जाएगा, इससे नहीं होता. ओके, चलो, यस, एंड द डिफरेंशिएटिंग पॉइंट. ओके, सेम modality is reversed in case of belladonna. Okay, if the patient was of belladonna तो उसको यहाँ पिलो में प्रॉब्लम होता है. He wants to pour his head in the pillow. If he came from this belladonna, okay, अगर belladonna का headache है, then it is clearly written in Boric Materia Medica, boring head in the pillow. That is the intensity. और उसके अलावा देखे तो ऑलमोस्ट आपको सिमिलरिटी मिलेगा. तो सेंसेशन से लेके इलमेंट्स से लेके आप सब देखे, इवन सेंसिटिविटी देखे आप पेशेंट्स की, दोनों में आपको सिमिलरिटीज मिलेगी. बट स्पेसिफिक मोडालिटीज आपको हंट करनी चाहिए. सो मेनी मास्टर यूज्ड टू से दैट रीड बिटवीन द लाइन्स. सो दिस पर्टिकुलर थिंग्स कैन बी वी कैन से आई ओपनिंग description. Okay, and this Midas scale, I used to take this Midas scale. Okay, I just convey this particular scale to patients and he filled it for me. Okay, so this is the we can say Midas tool. How many days in the last 3 months did you miss work or school? Okay, उस हिसाब से पूरा का पूरा Midas दिया हुआ है. उसमें 5 बेसिक क्वेश्चन है, राइट में है, और complete total आ रहा है 38 before treatment. Okay, so on the 3rd of February this Midas score was 38 and after almost 3 months February के बाद in the May, okay, month of May, the Midas score was 11. Okay, पहले वो था 38 से सीधा आ गए हम 11. Okay, so this is the, we can say, beauty of homeopathic remedy, or we can say homeopathic management of migraine. Okay, so that's all for the presentation. Okay. Yes, I like to show this chloride particularly. Okay. See, this is how it is written in headache by Genoseeking. Okay. So location, direction, character, giveaway, this probing in temples, and as it is, all the things were mentioned in the patient. Okay. He has mentioned this in the case. Okay. Yes, in occiput. Okay. Direction, giveaway, mental to occiput. Yes. Yes, better by sitting or sitting still or lying. Okay, reduced by pressure. Worse with the sun. Okay. Semilateral headache. See, by definition, बात करते हैं unilateral headache होना चाहिए. So in mathematics it is written semilateral headache. Okay, only in the morning in bed with inclination to vomit. Okay, this is the, we can say in clear terms written as migraine with typical aura. Okay. See, patient pain as if constricted, especially in occiput, extending to nape of the neck, which pains on looking up as if broken at noon. Afterward, pain extends back down back and to the chest. Okay. Okay. So this was written in the, we can say, line. Okay. Yes, this thing. Yes, hemicrania. Hemicrania sees half light, half dark. Okay, which was written the Materia Medica, and the patient told us like a sparkling thing of just like crescent moon. Okay, the shape of crescent moon. I can see this sparkling. Okay, and, only sees the half of the visual field. So it is very well written in a single word with terminology. Hemicrania sees half of the light and half dark. Okay. So that's all about the, let's say, this beautiful case.
Thank you, sir. Participants, we are open for the questions if you have. So meanwhile, we are waiting for the questions for the participants. I would like to add that I am definitely overwhelmed with this session, how deeply you have explained about such a beautiful case. Also, as you have explained wonderfully about the analysis and evaluation, which will definitely help our participants. So there is one question.
Yes.
Type of migraine are not clear.
Type of migraine. Okay, okay. Just a second. I will show you the.
Yes, sir.
Say, yes, I got it. Okay. Screen. Okay. I will share the screen so that you can see the.
No, sir, we cannot see your screen.
Okay. Can you see the screen?
Yes.
Okay.
We can all see
Yes.
the PPT, right?
Yes. Yes. Okay. So this is the ICHD3 manual, we can say, International Classification of Headache Disorder. See, yes. This is the table of contents. Okay. So primary headaches, migraine, tension type, trigeminal, ये सारे दिए हुए हैं और इधर मेंशन भी किया हुआ है कि कैसे आपको सब क्लासिफिकेशन को कंसीडर करना है. ओके, so just read this manual. It is we can say well versed and in an easy language, so everybody can we can say use this manual. Okay, I will show you the criteria. Okay, yes, this is the actual classification. Okay, ACHD 3. ओके, इसमें कोडिंग दिया हुआ है. बेसिकली 6 टाइप्स के अंदर इसको डिवाइड किया हुआ है. ओके, अप टू दिस पर्टिकुलर पॉइंट. यस, यहाँ से लेके यहाँ तक. यस, बिना पैरोक्सिस्म. ओके, खाली इतना माइग्रेन है यहाँ से लेके यहाँ तक. ओके, अभी इश्यू क्या है? फॉर सेक ऑफ डायग्नोसिस, just let me check. These all things are secondary headache. Okay, so single line is we can say different diagnosis. Okay, yes. Okay. Yes, migraine with aura, without aura, with aura, सब दिया हुआ है. इसका बेसिक इंट्रोडक्शन भी दिया हुआ है. और yes, I will take with aura. ये without aura दिया हुआ है. थोड़ा कमेंट्स. yes, with aura. Okay, previously used term दिया हुआ है, पूरा डिस्क्रिप्शन दिया हुआ है. डायग्नोस्टिक क्राइटेरिया पर डायरेक्टली जाते हैं. ओके, सो फुलफिलिंग क्राइटेरिया बी एंड सी. सो देयर इज रिवर्सिबल ओरा सिम्पटम, विजुअल, सेंसरी, स्पीच एंड लैंग्वेज, मोटर, ब्रेनस्टेम, रेटिना. ओके, उसके बाद है कैरेक्टरिस्टिक. ओके, 3 कैरेक्टरिस्टिक होना चाहिए. दैट इज एटलीस्ट वन ओरा सिम्पटम्स स्प्रेड्स ग्रेजुअली ओवर मोर देन 5 मिनट्स. ओके, एक ओरा सिम्पटम होना चाहिए और 5 मिनट तक परसिस्ट करना चाहिए. 2 or more aura symptoms occur in succession. एक के बाद एक हो सकता है. विजुअल भी हो सकता है, ऑडिटरी भी हो सकता है, सेंसरी भी हो सकता है. एक के बाद एक हो सकता है, 2 से ज्यादा हो सकता है. ओके, ईच इंडिविजुअल ओरा सिम्पटम लास्ट 5 to 60 मिनट्स. ओके, एक ओरा सिम्पटम मिनिमम 5 मिनट चलना चाहिए. सो सेम पॉइंट इज वी कैन से गिवन विथ इंडिविजुअल क्राइटेरिया कि एक हर एक ओरा का 5 मिनट चलना चाहिए, मिनिमम 5 मिनट चलना चाहिए. एटलीस्ट वन ओरा सिम्पटम इज यूनिलेटरल. एक ओरा सिम्पटम यूनिलेटरल होना चाहिए. एक ही कान से सुनाई दे रहा है, एक ही साइड मुझे आवाज आ रही है, या एक ही साइड विजन में प्रॉब्लम हो रहा है, कुछ ना कुछ यूनिलेटरल होना चाहिए. ये जो भी वी कैन से दिए हुए ओरा सिम्पटम्स. ओके, एटलीस्ट वन ओरा सिम्पटम इज पॉजिटिव. ओके, द ओरा इज अकम्पनीड और फॉलोड विद इन 60 मिनट्स बाय हेडेक. ओरा के 60 मिनट के अंदर हेडेक हो जाना चाहिए. ऐसा नहीं है कि 3-4-5 घंटे तक सिर्फ ओरा ही चल रहा है, ऐसा नहीं चलना चाहिए. ओके, सो दीज आर दी वी कैन से बेसिक diagnostic criteria for migraine with aura, and there is sub classification of typical aura and atypical aura. Yes, see 1.2.1.1 उसमें typical aura with headache, उसमें सेम दिया हुआ है कि भाई 1.2.1 migraine with typical aura है, उसका क्राइटेरिया फुलफिल होना चाहिए. उसके अलावा क्राइटेरिया बी जो मैंने केस में लिखा हुआ था कि भाई विद और विदाउट माइग्रेन का कैरेक्टरिस्टिक होना चाहिए और ओरा विद इन 60 मिनट्स कंप्लीट होना चाहिए. ओके, फिर उसका भी सब क्लासिफिकेशन दिया हुआ है. ओके, तो उस तरह से ICHD 3 में सारा लिखा हुआ है. सी ब्रेनस्टॉर्म ओरा और हेमिप्लेजिक जो मैंने खाली एक पेज में दिखाया था ना कि इतने सारे माइग्रेन क्लासिफिकेशन दिए हुए, ये उसका डिटेल वर्जन विद डायग्नोस्टिक क्राइटेरिया. So each and every symptom we have to look for it. Okay, each and everything हमको एक एक चीज देखना पड़ता है, उसके हिसाब से we can say डायग्नोसिस करिए. और मैंने इजी प्रोसेस क्या किया, मैंने स्टार्टिंग किया था केस प्रोसेसिंग का प्रोविजनल डायग्नोसिस. ओके, डिफरेंशियल डायग्नोसिस देन प्रोविजनल. ओके, सो डिफरेंशियल डायग्नोसिस में मैं ऐसे करता हूँ, जो जो सब क्लासिफिकेशन मुझे लगता है कि फॉर एग्जांपल ये पर्टिकुलर क्राइटेरिया है जो मैच हो रहा है, तो मैं उसका लिस्टिंग कर देता हूँ कि भाई ये लिख लो, ये लिख लो, ये हो गया, ये हो गया. 3-4-5 जितने भी मतलब चेकलिस्ट कंप्लीट होते हैं उसका मैं मेंशन कर देता हूँ. फिर एक एक को 1 by 1 रीड करता हूँ जो केस से सिमिलर होते हैं. ओके, उस हिसाब से एक्सक्लूजन वे में हम डायग्नोसिस देते हैं. ओके, ये पूरा मेन्यूल आपको ICHD 3 के इंट्रोडक्शन में दिया हुआ. ओके मैम,
Thank you so much, sir. Next question we have is Sir, can you please provide us PDF of this webinar?
Okay, yes, I can. मैं सारा दे सकता हूँ
Thank you.
presentation. लावण्य मैडम को शेयर कर दूँ तो
Hmm.
चलेगा?
Sure,
Yes, sir.
sir. We'll be sharing. Yes, sir.
Okay, I will do that.
Thank you, sir. Next question. Can we prefer biochemic also?
Okay. पर्सनली अगर मैं कहूँ तो बायोकेमिक में एक ही इशू हो रहा है. फॉर एग्जांपल हम कोई भी इंडिकेटेड होम्योपैथिक रेमेडी दे रहे हैं जो पूरा केस से सिमिलर भी है, मतलब टोटालिटी और सब कुछ कंसीडर किया है हमने, और हम कोई रेमेडी दे रहे हैं. उसके बाद हम फॉर सिंगल सेट ऑफ सिम्टम, अगर मैं सोच रहा हूँ कि भाई चलो नर्व से रिलेटेड है, मैं कालीफोस दे देता हूँ. ओके, अगर ऐसा सोच के हम खाली बायोकेमिक प्रिस्क्राइब कर रहे हैं तो दिक्कत ये होगी कि भाई ट्रीट किसने किया. जो हमने सिमिलिमम ढूंढा था, जो टोटालिटी को कवर करता है, उसका इफेक्ट है, या जो बायोकेमिक सिस्टम से जो मेडिसिन हमने निकाला है उसका इफेक्ट. ओके, दूसरी बात, जब हम कोई इंडिकेटेड रेमेडी प्रिस्क्राइब करते हैं उसके साथ सेम बायोकेमिक रेमेडी दे सकते हैं कि नहीं, वो अपने आप में एक क्वेश्चन है. ठीक है, मेनी टाइम इट मे हैपन कि हम जो भी इंडिकेटेड रेमेडी दे रहे हैं, अगर बोरिक में रिलेशनशिप में ठीक से देखे तो नीचे लिखा होगा एंटीडोट और वी कैन से इनिमिकल. ओके, तो अभी अगर इनिमिकल वाली लाइन में, एंटीडोट वाली लाइन में अगर हमारी बायोकेमिक है तो एक तो हमने पहले केस पे पूरा काम किया, फिर हम कोई एक रेमेडी पे आए और उसको हमने प्रिस्क्राइब किया, और उसके बाद हमने बायोकेमिक देके केस का कचरा कर दिया. ओके, सो ये मेरा पर्सनल ओपिनियन है कि अगर हम कन्वेंशनल क्लासिकल वे में चलते हैं और उनको फॉलो करते हैं तो अननेसेसरी बायोकेमिक मेडिसिन प्रिस्क्राइब करने की जरूरत नहीं पड़ेगी. हाँ, कब प्रिस्क्राइब कर सकते हैं? फॉर एग्जांपल हम केस को मतलब ट्रीट कर रहे हैं, फिर इवेंचुअली विद इन अ शॉर्ट टाइम कोई ऐसा मतलब आ जाता है, एक्यूट एपिसोड आ जाता है या एक्यूट एक्सरसेबेशन हो जाता है जब particular set of symptoms should be dealt. Okay, then there might be a chance कि हम कोई बायोकेमिक सिस्टम का बायोकेमिक रेमेडी दे सकते हैं. okay? कोई क्रोनिक केस चल रहा है और देखा चला इसका हीमोग्लोबिन थोड़ा कम हो रहा है, मैं फेरमपोस दे दूं, आप इस तरह से प्रिस्क्राइब करते हो तो कोई बात नहीं, वो कोई बड़ी बात नहीं है. बट ये रेमेडी रिलेशनशिप हमको देखना पड़ेगा. ओके, रेमेडी रिएक्शन तो एलोपैथ्स भी देखते हैं, तो हम क्यों नहीं देखते? वो भी देखते हैं कि अगर सपोज कोई आयरन सप्लीमेंट्स पे चल रहा है और एंटासिड्स खा रहा है तो वो तो सब कुछ पानी में जाएगा. ठीक है, तो दो चीजें साथ में नहीं करनी. वो बकायदा कहते हैं कि भाई सपोज अगर एसिडिटी का कुछ भी है, आप अननेसेसरी दवाई खा रहे हो और राबेपराजोल वो सब खा रहे हो तो बंद कर दो. जब तक ये सप्लीमेंट लेना है तो बंद कर दो. अगर आपको सपोज एसिडिटी का प्रॉब्लम से, दवाई का टाइम डिफरेंट कर दो. ऐसा नहीं कि खाने के पहले आपने एंटासिड ले लिया फिर आप खाने के बाद आयरन सप्लीमेंट ले लोगे. एलोपैथ्स भी ये सब देख रहे हैं, तो हम तो होम्योपैथ्स है, हम डायनेमिक लेवल पे काम करते हैं. ओके, यस.
Thank you, sir. Participant, please, if you have any other question. I would like to ask you the question. Can you please share the name of the book which you have shown in the PDF?
Yes, yes. See, this book is Headache. Okay, the name is just like Headache. I have printed these we can say particular cover part. Okay, the issue is that it is published by forgotten publisher, and I mailed in that I want a copy. I want to purchase a copy for my thesis, and they told me that you cannot send a single copy, even for the research purposes. If you want to buy it, you can buy it in a bulk, almost 50 to 100 copies. So that's why I just printed it on my own. Okay, and I we can say kept a printed copy. Okay, and I used to read it and underline each and we can say particular symptoms, which is very helpful for me to guide in a we can say to be guided in a case. So this is the book. Okay, मैं उसका पूरा नाम आपको दे देता हूँ.
Thank you so much, sir. I don't see any more questions from the participants right now.
Thank you. Thank you, all the listeners.
Thank you so much, sir. Ma'am, over to you.
Thank you, sir. Thank you so much for enlightening us with a wonderful session. Respected participants, regarding the conference, there are all the updates given in the Homeo 360 degrees Aisha page. I would like to all the participants to check it out for all the further updates and for all the competitions also, and whichever they want to participate. And thank you, sir. Thank you so much for the enlightening session. We would like to hear from you more. As it your second section, we'll always get overwhelmed and knowledgeable with your session. And thank you, Team Aisha, for this wonderful session. Thank you all the participants for their participation, and thank you all. Good night.
Thank you.